Maine runner Gary Allen is one of the few people to run a marathon in less than 3 hours in 5 decades. He lives on Great Cranberry Island and trains on the island's 2-mile road. Well, this past year, deterioration in his knee threatened to end his running career. CBS 13's Brad Rogers shows you the miracle cure that got him back on his feet.
Gary Allen is one of Maine's longtime elite runners. For 5 decades, he's either been running marathons or training for them. His legs have logged more than 100,000 miles, the equivalent of running 4 times around the world.
I mean, that's a chunk on a car odometer, let alone on a person.
Miles that put wear and tear on his knees. This past year, his right knee got so bad, he had to stop running. He says even standing up was painful.
You would pretty much said, you know, I wasn't ever going to run again.
Allen found out a Bar Harbor doctor was helping athletes with a relatively new procedure that didn't involve knee surgery.
My practice was one of the first 2 in the state of Maine to start doing it.
It's called platelet-rich plasma injections, or PRP for short. Dr. Mark Kendich says the best PRP candidates are the ones where medicine no longer helps, but whose damage is not so severe it requires knee surgery.
So there's sort of a sweet spot for when PRP is the most effective treatment that I know of.
Platelets are what cause the blood to clot, but they also contain tissue growth factors that trigger your body's cells to start the healing process.
And that's part of the way that the body gets the surrounding tissue of the wound to begin healing.
6 weeks ago, Allen went in for the procedure. His blood was put in this centrifuge, separating the platelets.
This part here has actually got mostly platelets in it. There's a surprising amount of platelets in the blood.
The platelet-rich plasma was then drawn into a needle and injected right into the ligaments of Allen's right knee.
Ready?
Mm-hmm.
There is no blood flow inside knees. Otherwise, Dr. Kendich says a damaged knee might heal itself.
Our target is this line right there.
The platelet-rich plasma should trigger cells to start healing the worn-down meniscus cartilage in his knee.
We believe that this can trigger some regeneration of tendon tissue and hopefully even some joint cartilage.
You can only control what you can control. You know all this.
Allen says after only a few weeks, he can't believe how much better his knee feels. He's also running again.
I came in and had the procedure done and walked out the same day. And then 3 days later, you know, honestly, 2 days later, I was getting around fine.
How are you feeling?
All the symptoms that brought me to you have disappeared, all of them.
It also feels like night and day from when I first came to see you.
So it's pretty miraculous.
Yeah.
I mean, it's pretty cool.
Even Dr. Kendich is amazed how quickly the healing begins.
I'm a little puzzled by that myself, but you do see that. Most people that are treated have a real satisfactory result.
Doctors report success rates of anywhere from 80 to 95% for patients who've had PRP injections in their elbow, ankle, or knee. Allen says it worked for him.
My knee's vastly improved from when I had the procedure done 3 weeks ago. You know, I can run and it doesn't hurt, so that's a big step forward.
Gary Allen is hoping to reach a milestone at this year's Boston Marathon, his 100th marathon. He says without this procedure, that would have never been possible, and he will decide the morning of the marathon if he runs. On Mount Desert Island, Brad Rogers, CBS 13 News.